distal part up like this. Okay, this is contracting. So this muscle now is causing flexion. Do you see that? Any muscle crossing in front of a joint will cause flexion. This is for most of the body. So I showed you at the elbow. It will be the same at the wrist. So imagine if I put this down and I took this muscle down into the wrist, and let's say I attached it here. Now if this muscle contracts, can you see it's going, when it's shortening, it's going to flex the wrist. Okay, can you see that muscles crossing in front will cause flexion at a joint? The same thing will hold true even say for the abdominal region. So any muscle going in front like this, down here, like for example your rectus abdominis and your oblique muscles up here, when they contract, so when the muscle shortens, I can't do this because this is fixed. So can you understand that your whole thoracic cage will bend over like that, right? Which is like this, which is what you do when you do sit-ups. Okay, can you see that? So muscles crossing in front. This rule, however, will change when we go from the knee downwards. For the hip, it still remains the same. So imagine here, like you have a muscle which is crossing in front of the hip joint. So here, imagine a muscle crossing in front of the hip joint, and let's say it's attached somewhere on the femur. So now you can see here the muscle is kind of in a relaxed state. When I shorten the muscle, can you see it's going to pull up, right? The muscle is shortened, so it's going to cause flexion. So in front, anything crossing in front will cause flexion. So when you lift your leg, your thigh up like this, you understand that is flexion. But when you take from the knee downwards, this rule changes, because in the knee, when you look at the knee, so here I'm showing you the knee. In the knee, this is extension and this is flexion. Do you see this? This is extension, this is flexion. In the ankle, we don't use the word extension and flexion. We use the words dorsiflexion and plantar flexion, with dorsiflexion being the same as extension and plantar flexion being the same as flexion. Okay? Think of it, because if knee is extension, the same thing for the ankle. So when you lift your toes up and point towards the ceiling, this is called dorsiflexion. This is produced by muscles which are extensors. So this is extension. Dorsiflexion, think of it the same as extension. And plantar flexion, which is the opposite movement, where when you stand on your toes with your toes pointing down, that's the same as flexion. So here in the case of the knee, look at this, muscles crossing behind the knee joint. So when you have a muscle which is present from here, let me show it to you this way. So when you have a muscle which is attached here to the posterior surface of the femur, and let's say it goes to the tibia or the fibula like this, when this muscle shortens, can you see what it's going to do? It's going to cause flexion, right? So muscles crossing behind the knee will cause flexion, unlike in the rest of the body. Similarly, muscles which cross behind the ankle joint, so if they attach from the tibia and they go to any of the tarsal bones, let's say the calcaneus or talus or whatever, so when they contract, you understand, they're going to pull, and this is not moving, but they're going to pull this talus or this calcaneus up towards themselves, so they're going to cause the foot to go down this way. Okay? So that's the principle of muscle action for flexion. Any muscle crossing in front causes flexion, but for knee, ankle and the toes, any muscle crossing behind will cause flexion. Okay? Let's look at extension. So therefore it would be the opposite for extension. So any muscle crossing behind a joint, so let's say, let's take the elbow joint. So we have a muscle which is attached to the posterior surface of the humerus and attached here anywhere, let's say on the radius or the ulna. So when this muscle, so when you're looking at the back up here, so you're looking at the posterior aspect. So now when this muscle contracts, so imagine if you have a flexed position like this, you can see this muscle is stretched. When this muscle contracts, can you see it's going to bring it back to the normal position which is extended. Okay? Same thing for the wrist. So imagine a muscle which goes from the radius or ulna, so from anything and going towards the digits or even going to any of these carpal bones. So you can see when your wrist is flexed, these muscles are stretched. When they contract, these muscles will extend your wrist. Okay, so muscles crossing behind cause extension. You can understand the same, it would be for the neck or any muscle at the back. So imagine a muscle which is present on the posterior aspect like this. When this muscle shortens, it's going to bring your head back this way, which would be extension. Same with your back muscles, right? They would be antagonists of your rectus abdominis and obliques here, because when these rectus abdominis and all contract, they pull your thoracic cage down, whereas these will straighten it up, so they will cause extension. Now for the hip, it would be the same. So any muscle crossing behind the hip joint. So imagine a huge muscle like the gluteus maximus crosses behind the hip joint. It's attached to the hip bone and attached to the femur. So when this muscle contracts, look at this, when it shortens, what is it going to do? It's going to cause extension, okay? But, however, from the knee downwards, this changes, because here, if you have a muscle which is present in front of the knee joint, like a huge muscle known as the quadriceps. So we have this muscle. Most of it arises from the femur, and this muscle comes and inserts on the tibia. So you can see when somebody is flexing their knee, this muscle is stretched, right? So when this muscle contracts, can you understand what is it going to do? It's going to extend the knee, right? So muscles crossing in front of the knee will extend. Look at this one. Muscles crossing in front of the ankle. So say a muscle arising from the tibia going to one of the tarsal bones. So when your plantar flex, this muscle will be stretched. When this muscle contracts, what will happen? It is going to pull this up like this. So can you see? It's going to cause dorsiflexion. Okay? So you should remember, any muscle crossing in front would cause dorsiflexion. So those are the principles for flexion and extension. So now let's look at something for adduction and abduction. So let's look at adduction first. So in adduction, we have what is the movement of adduction? Adduction is getting the limb towards the midline, right? This way. So this is adduction of the at the shoulder joint. This was abduction. This is adduction. Same with the hip. This is abduction. This is adduction. So here you have a movement where from lateral it is coming medial. Okay. So muscles which have a medial to lateral attachment. So imagine like there's this big muscle which is present on the front of the chest wall called pectoralis major, attached here to the sternum, the costal cartilages and the clavicle, and it goes to the humerus. So look at this, when your arm is abducted, can you see that this muscle is stretched, right? Okay. So at this point you can see it's stretched, so its action is not going to be abduction. However, imagine this muscle has to shorten. What is it going to do? It's going to try to pull the humerus closer towards the chest, because you cannot move the chest towards the humerus. So when it pulls, can you see, it will cause adduction. So muscles which go from medial to lateral pull on the lateral bone and they cause adduction. The same thing holds true for the hip. So imagine here you have these muscles and they have the names adductors, so you automatically know their action. So they arise from the pubis and they go towards the femur. So they're going towards the femur. So again, you can see in abduction they are actually stretched. When these muscles contract, you can see they're going to try and pull the femur closer to the midline, which is what happens when you stand at attention. So they're going to cause adduction. Abduction is a movement where you have muscles where the muscles cause a movement which makes the bone go away from the median plane, which is this way, or in the case of the hip, it's this way. So here we have muscles which are attached have a proximal to distal attachment, and they are attached along the lateral side of the joint. So you can see this is the lateral aspect of the shoulder. Here this would be the lateral aspect of the hip. So when muscles which are attached on the lateral aspect, for example, there's this big muscle which forms the contour of your shoulder, the deltoid. So here this muscle, imagine if this muscle contracts, it is attached to the clavicle and the scapula. When it contracts, when it shortens, can you see what is it going to do? It's contracting, so it's shortening. So it's going to lift. See this? It's going to lift the humerus up, so it's going to cause abduction. The same is true for muscles which are present on the lateral aspect of the hip joint. These are called gluteus medius and minimus. They go from the hip bone to the femur on the lateral aspect. So again, when they contract, what will they do? They will pull the femur up like this, causing abduction. Okay? So if you understand these principles, you really don't need to memorize the actions. And then in joints like the shoulder and the hip, we also have rotation. So any muscle which crosses in front of a joint, so like this, like pectoralis major, crossing in front, when it pulls, it will rotate this medially. Any muscle crossing behind the joint, like all these little muscles which are here, like supraspinatus and infraspinatus, when they are attached, imagine when they contract, they are going to cause lateral rotation. This doesn't move, but this is going to turn laterally like this. So it's going to pull it laterally, okay? So muscles crossing behind cause lateral rotation. Muscles crossing in front cause medial rotation, okay? So those are the basic principles of muscle action.